Okay, so good afternoon, everyone. So this is Pooja, and I would like to welcome you all to a live session from Let's Update Language Academy for OET reading subtest. So let's just wait for a few moments for more people to join in, and then we'll begin shortly. Okay, so I can see your comments in the comment section in Facebook. So, yes, good afternoon, Gypsy Sanil. And yes, good afternoon, Sini John and Priya Amu and Leju K. Nair and Marin Mary Kuriakos. And hello, Victoria, Anjana, Sandra. Good afternoon to all of you. And yes, hello and good afternoon, Mercy Kamlesh. And so now we are about to begin the session for OET reading subtest. So I would like to give you a set of general instructions for those of you who are attempting for the very first time. That is, the OET reading subtest is subdivided into three. That is A, Part B, and Part C. And so you will have a total of 42 questions, and you will be having a set of 20 questions from part A, 6 questions from part B, and 16 questions from part. Okay. So, and regarding the time duration, you will have a total of 60 minutes, from which 15 minutes will be allotted to part A and 45 minutes for part B and C together. So you will have a total of 1 hour to crack the test. And so today we shall be having the discussion of part C module of the reading subtest. And so I would just like to tell you that basically part C will assess your ability to identify the detailed meaning and opinion in two different set of. Each text will be about 800 words each, and it will be based on topics of interest to healthcare professionals. Okay, so regarding the number and type of questions, so these two long texts will be followed by a set of 16 questions. Okay, and the nature of questions will be 4 option multiple choice. Okay, so you will have 4 different choices from which you have to decide and choose the most appropriate answer for each question. And regarding the approach to solve part C of reading subtest, that is, you need to read the question first to know what information you need to find, and then you can read the content of the text of the paragraph, and then read the answer options. Okay, and decide and choose the most appropriate answer. Okay, so that is the way you have to approach part C section. And now we are going to have a reading discussion of a part C extra. Okay. Okay. So usually the pattern is such that there will be a long text which will contain around 8 to 10 paragraphs, and that will be followed by a set of 8 questions. Okay, so and then you will have another long text followed by another 8 questions. So you will have a total of 2 texts and 16 questions. Okay, so last week we did the C1, that is the first text from the part C section, and today we will be discussing C2, that is the next long text from part C section. Okay, and for your convenience, I have arranged the questions in such a way that each question will be um, after each paragraph, because the construction is such that each question, the very first question in part C, will be from the first paragraph, uh, second question from the second paragraph, third from the third paragraph, and so on. Okay, usually the pattern is such. So I have, for your convenience, for you to be able to see the paragraph as well as the question at the same time, I have arranged it in such a way. Okay, so you can see both at the same time. So now, um, let's go to the very first question, that is yes, of C2. Okay, so that is question number 15. So, what did past studies suggest about coffee and tea? Okay, so that is the question, and as you can see, it would be from the very first paragraph. So I'll give you a minute to read the paragraph, and you can choose the most appropriate answer and put your answers in the comment section Facebook, and I'll read out your answers, and then we'll definitely discuss the answer. Okay, so I can see your answers coming up already. So I'll just read the paragraph, and then so that I think more of you will come up with your answers, and I'll read it all together. So, yes. So the paragraph is: after years of studies that seemed to swing between dire warnings and cheery promises about what our favorite caffeinated beverages do and don't do, much of the recent science regarding coffee and tea is generally positive. So, and the question is, what did past studies suggest about coffee and tea? And options are: A, they produce clear evidence that they were harmful; B, they produced clear evidence that they were beneficial; C, they produced evidence that they could be either harmful or useful; and option D, they didn't produce clear evidence on whether they are harmful or useful. So, and let me read out your choice of answers. In the comment section, Marin Mary Kuriakos has responded with D. Ritu Bright has responded with B. Victoria, Rajiv Varghese, Atulya Prakash, and Anjana has responded with D. And what about the rest of you? Okay, so let me tell you the answer. Since they have mentioned that in the very first line itself, that after years of studies, that means they did a study and they have got evidence, and it seemed to swing between dire warnings and cheery promise. Warnings in the sense, okay, regarding the negatives or the harmful effects, and cheery promises in the sense that means benefits, obviously. So about what our favorite caffeinated beverages do and don't do. Okay, whether they give you benefits or they don't give benefits, or whether they are harmful or they are not. So after years of studies, uh, that is what they have got. Okay, the evidence were swing that seemed to swing between both ends. Okay, whether like between dire warnings and also promises. Okay, so, yes, that is what they seemed to say, and that is why your answer should be C. They produced evidence that they could be either harmful or okay, because it was swinging that they have studied about it, and evidence seemed to be swinging between the positives and the negatives, or harmful or the harmful effects or the benefits. Okay, so and because of which your answer should be. I'll just highlight the part of the paragraph which will take you to this answer. Okay, so moving on to the next question. Okay, so I'll give you a minute to read the paragraph and answer the question, and then we'll discuss it. Okay, so I think you are, I can see your answers coming up already. So I'll just read this paragraph. The WHO's International Agency for Research on Cancer recently took coffee off its list of suspected carcinogens. And some research suggests it could help keep colon cancer from coming back after treatment. Other studies suggest drinking coffee might stave off Alzheimer's and Parkinson's disease. Okay, so now the question is, according to some research, option A, coffee can be used as an effective treatment for Alzheimer's and Parkinson's diseases. B, Alzheimer's and Parkinson's diseases can be caused by coffee. C, Alzheimer's and Parkinson's disease can effectively be prevented by coffee. And D, drinking coffee may help with the prevention of Alzheimer's and Parkinson's disease. So these are the four options, and what do you think is the correct answer for this question? Please put in your choice of answers in the comment section in Facebook. Okay, so Chaudhary Imran has put in B as answer, and Mahesh Gussi has put in B as answer. Okay, what about the rest of you? You can definitely put in your choice of answers in the comment section. Okay, Linju Dominic has put in D as answer. Mercy Kamalesh has responded with D. Okay, so let me tell you the correct answer. The correct answer is D. Drinking coffee may help with the prevention of Alzheimer's and Parkinson's disease. I'll just highlight the answer and I'll tell you why it's D. Okay, so what does this paragraph suggest? So that is the WHO's Agency for Research and Cancer. So they took coffee off its list of suspected carcinogens. Okay, so they do not suspect it to be causing cancer. Okay, that's why they might have taken it off from that. Right, and some research suggests it could help keep colon cancer from coming back after treatment. Okay, so it also suggests that it could help colon cancer from coming back after treatment. Okay, having coffee. Okay, and other studies suggest drinking coffee might stave off means prevent, so might prevent Alzheimer's and Parkinson's diseases. Okay, so that is what they suggest. That is some studies what they have done that suggests so. Okay, so what do you think would be the correct answer? Let's look at A. Coffee can be used as an effective treatment for Alzheimer's and Parkinson's. Okay, that is a confirmation statement. Option A is a confirmation. They are giving a confirmation that it can be used for the treatment, but no. In our paragraph, what is said is it might. It suggests that it might. Might is a probability. It's not a confirmation. And that is why you cannot take A for an answer. I'll just highlight that part and that is why we eliminated A, and then look at B. Alzheimer's and Parkinson's disease can be caused by coffee. No, not at all. That is not something said in the paragraph, and that is why we eliminated B. And what about C? Alzheimer's and Parkinson's diseases can effectively be prevented by coffee. Again, that's a confirmation statement, and what we have in the paragraph is just a probability. Okay, and that is why we have chosen option D as answer, because option D is a possibility again, or a probability again, as suggested in the paragraph. Drinking coffee may help with the prevention of Alzheimer's and Parkinson's. Okay, so this is a very important thing that you need to note. Okay, whether a probability is suggested or confirmation is suggested, and what is suggested in the options. Okay, and that is why your option is D. Okay, I hope that's clear. So moving on to the next paragraph and question. So I'll give you a minute to read this by yourself and come up with your choice of answers, and then we'll discuss it. Okay, so now I'll just read the paragraph. So, various studies have pointed to tea drinkers having lower odds of skin, breast, and prostate cancers. Researchers are still trying to pinpoint the exact ways that happen. But tea, particularly green tea, is rich in compounds like antioxidants, which can limit cell damage and boost the immune system, and polyphenols, which have been shown to lower blood pressure and cholesterol. It also may help stave off Alzheimer's disease through a polyphenol known as EGCG, which prevents the formation of plaques that are linked to that brain damaging. Okay, so that is what the paragraph is about. And moving towards the question, which of these effects is not attributed to drinking? So they are asking for something that is not attributed to drinking. Okay, so you have to find something which is false or incorrect. Okay, because you need not find something that is linked or contributes or which is connected to drinking tea, but something which is not. Okay, so now moving to the options: A, decreasing the risk of breast cancer; B, increasing blood pressure; C, strengthening the immune system; and D, decreasing the risk of developing Alzheimer's disease. So these are the four options, and definitely you can respond with your choice of answers in the comment section on Facebook. Okay, I think Priyanka has responded with B, and more of you can put in your responses in the comment section. Okay, so let's look what they have discussed over here. Okay, so definitely they have pointed that tea drinkers have lower odds of skin, breast, and prostate cancer. That means they have lower risk, okay, of getting these type of cancers. And researchers are trying to pinpoint the exact way that happens. And definitely they are telling about the benefits of green tea as well. Okay, and okay, let's look at these options and try to see which of it is mentioned. And looking at option A, decreasing the risk of breast cancer, is that mentioned? Yes, that is mentioned in the beginning, right? And yeah, it is suggested over here. So I'll just highlight it in green because it is actually mentioned. And look at option B, increasing blood pressure. Is that mentioned? Okay, what they have suggested is it has shown to lower blood pressure, not increase. Okay, and because of which this will be okay. So now look at C, strengthening the immune system. Uh, have they mentioned that it will strengthen the immune system? Definitely, that is, it will boost the immune system. That means strengthen the immune system, and so that is also mentioned. So option A is mentioned, C is mentioned. Looking at option D, decreasing the risk of developing Alzheimer's disease. Yes, so that is also mentioned because they have suggested that it also may help stave off Alzheimer's disease. Okay, so I'll highlight that also. So that is also mentioned. Okay, so now the A, C, and D is mentioned. So we are left with B, and B is the answer to this question because they have asked about something that is not attributed to drinking. Okay, so because they have mentioned that drinking tea will lower blood pressure, not increase it. That is an incorrect statement, and because of which that is the answer. Okay, I hope that is clear to you. So now let's move on to the next question and paragraph. Okay. So I'll give you a minute to read it by yourself and come up with your choice of answers in the comment section. Okay, so now I'll read this text. So, is one better for you than the other? Experts say that's hard to say. It's because it's difficult to separate out the different ingredients, their role in your diet, and their effects on different body systems. I think people are looking at both coffee and tea and how they affect everything, including cancer and GI disease and cardiovascular diseases. Says Eliot Miller, MD, a critical care medicine specialist at the National Institutes of Health. Okay, so that was what the paragraph was about. So moving towards the question, what does fourth paragraph suggest? Okay, so and the options are A, that it's easy to determine the positive effects of coffee and tea. B, that it's not easy to determine the positive effects of coffee and tea. C, it's not easy to determine which one is healthier, coffee or tea. And option D, that the positive effects of coffee and tea are determined by their role in your or our diet. Okay, so those are the four options. Now you can put in your choice of answers in the comment section. Okay, so I have got Lejukianar has responded with B and Priyanka has responded with B. Okay, so let's look at this paragraph. So now what they have suggested is they are asking you, is one better than the other? So experts say it's hard, it's actually a difficult thing to actually say, because it's difficult to separate out their different ingredients, their role in your diet, and how it's going to affect your system. So people are looking at both coffee and tea and how they affect everything, including cancer and GI disease and cardiovascular diseases. Okay, so what they have suggested here, it's difficult to separate out their different ingredients, their role in your diet, and their effects on different body systems. So the very first thing what they have said is one better for you than the other, one and the other. Okay, so they are suggesting one should be either coffee, other one should be tea. Okay, well, so they are asking you whether coffee is better than tea or whether tea is better than coffee. Okay, so that is what they are asking, and the answer for that is it's hard to say. It's difficult to answer. Okay, and that very first sentence will take you to the. Okay, so they are asking, so whether coffee is better than tea or whether tea is better than coffee, and definitely it's difficult to say the answer for this question. And so it's C, it's not easy to determine which one is healthier, whether it's coffee or tea. So it's between coffee or tea. It's not about the positive effects or it's not about the negative effects. It's which one is better. Okay, that is what the paragraph says. Okay. And it's definitely a difficult question to answer, and that is why we are saying it's not easy to determine. Okay, so I hope that is clear to you. Moving to the next paragraph and question. So I'll give you a minute to read it yourself and come up with your choice of answer in the comment section. Okay, so I'll read the text. So, Miller and his colleagues recently looked at signs of heart disease in more than 6,800 people from different backgrounds across the country. About 75% drank coffee, while about 40% reported drinking tea. Drinking more than 1 cup of tea regularly was linked to less buildup of calcium in arteries that supply blood to the heart, development that can lead to heart disease. Coffee didn't have an effect either way on heart disease, but that was significant in itself. Miller says, very often patients will ask the doctors, hey doc, I have got coronary artery disease or I have got risk factors like high blood pressure or cholesterol. Is it safe for me to drink coffee? Because everyone thinks drinking coffee makes your heart excited and is potentially bad, Miller says. So finding that it's neutral, I think is pretty important. So that was what the paragraph was about. So now let's look at the question. What is Dr. Miller's opinion on the findings? And the options are option A. Coffee increases the risk of heart disease in 75% of the people who took part in the research. B. Coffee has no effect on heart disease. C. The fact that coffee has no effect on heart disease is noteworthy. Option D. From now on, patients will stop asking doctors if coffee is safe to drink. Okay, so you can put in your choice of answers in the comment section in Facebook. Okay, so I can see Harsha Group has responded with C, Josna Janish has responded with C, Rajiv Varghese with C, Priya Amu with C, and Chaudhry Imran has responded with D. Okay, so okay, let's look what the correct answer is. The correct answer for this question, just highlight the answer, is C. The fact that coffee has no effect on heart disease is noteworthy. And why do we say so? Because it's just written here that okay, coffee didn't have any effect either way on heart disease. It means coffee didn't have an effect on heart disease, but that was significant in itself. That means, what do you mean by significant? Important, okay, or noteworthy. Okay, so that was significant in itself. That coffee doesn't have an impact on heart disease. That is why your answer is C. The fact that coffee has no effect on heart disease is noteworthy. In the sense, significant or important. Okay. And definitely the other options will get eliminated because B is incomplete. What they have said is it definitely doesn't have any effect on heart disease, but then they have not mentioned that it's noteworthy or significant or important. But you have a very specific answer there. Exactly what is mentioned in the paragraph is mentioned in option C. So will definitely have to take option C because that is the most appropriate option than B, definitely, because it's a complete answer, not as incomplete as B. And looking at A, coffee increased the risk of heart disease in 75% of people who took part in the research. No, what they have mentioned is about 75% drank coffee. Okay, that is the number of people who drank coffee. Okay, it's not about coffee showing about coffee's risk effect. Okay, and that being seen in 75% of people. That is not what is mentioned over. Okay, so A is eliminated, B is eliminated, and moving to D. From now on, patient will stop asking doctors if coffee is safe to drink. Why? Because it's not mentioned in the paragraph that they will stop asking these questions. Definitely, they were asking these questions because they had these preconceived notion about the harmful effects of coffee. So they have been asking these questions, but nowhere in the paragraph have they mentioned that they will stop asking. Okay, because and not everyone is aware of the real effects of, yeah, and that is why. And we have eliminated D, so thereby eliminating A, B, and D, your correct answer will be C. Okay, so I hope that is clear to you. And moving to the next paragraph and question. Okay, I'll give you a minute to read this paragraph and come up with your choice of answer. Okay, I can see a lot of you have responded previously to the question that was Pinchu Dominic, Marin Mary Kuriakos, Abraham Catherine, Josna Jinesh, Raju Varghese, Sam Sisley, Bindu Bright, Shabina Payoli, Tito Paulos, Prince Anthony, Tiji, Alex, Lejuke Nair, Soja, Sunny. Okay, all of you have responded for the previous question. And now, please read this paragraph and we'll discuss this. Okay, so I can see answers coming up already. So I'll read this paragraph. Researchers say it's hard to pinpoint exactly how both drinks affect health. Both coffee and tea are complex beverages that contain a variety of ingredients. They include caffeine, polyphenols, and antioxidants compounds researchers are studying for their potential cancer fighting properties, says Lisa Simperman, a clinical dietitian at University Hospital's Case Medical Center. It's more of a dynamic interaction than one single compound. Simperman says some people have tried to isolate one element in tea or coffee that they think is the secret to one effect or another, and then they realize that it doesn't have the same effect. Simperman said drinking tea has been linked to lower risks of cancer and heart disease, improved weight loss, and a stronger immune system. Meanwhile, studies point to coffee as a potential way to head off not just Parkinson's but type 2 diabetes, liver disease, and heart problems. Simperman says. Okay, so that was what the paragraph is about. And moving towards the question, what makes coffee and tea beneficial according to Simperman? And the options are a secret ingredient found in coffee and tea, B, the relations among the complex ingredients coffee and tea contain, option C, one single compound isolated by some scientists, and option D, the fact that they help to fight many different diseases. And so now you can put in your choice of answers in the comment section. Okay, Merin Mary Kuriakos has responded with B. Uh, Ritu Bright has responded with B. Mahesh Gasti with A. Harish KG with A. TG Alex with B. Shabina Payoli with D. Raji Varghese with B. Linju Dominic with D. Priya Ammu with C and Lejukia Nair with A. Okay, so now we'll look at the correct answer for this question. Okay, so now the correct answer for this question is option B. Relations among the complex ingredients coffee and tea contain. Okay, and that is the correct answer. And why is it so? Okay, so the question is what makes coffee and tea beneficial according to Simperman? Okay, so what they are suggesting in the paragraph that it's hard to pinpoint exactly how the drinks affect the health. Both are complex beverages because it contains a variety of ingredients. Okay, and that is why they are called complex beverages. Okay, because it contains a variety of compounds like ingredients like caffeine, polyphenols, antioxidants, etc. And compounds, and these compounds actually have cancer fighting properties, and researchers are studying for these compounds for their potential cancer fighting properties, and because of it it's more of a dynamic interaction than one single compound, and that is what the paragraph says. Because what some people actually did is they tried to isolate one element or one compound each from tea and coffee. Okay, and then they try to check whether they have the same effect or not, but they didn't have the same effect. Okay, the beneficial effect as much as tea or coffee has. If they try to isolate just one element or compound, it did not have that same particular effect. Okay, but if they are all merged together, if they are all taken in combination, then it is having a, what do you say, a beneficial effect. Okay, that is what they actually suggest in this paragraph. Okay, so it's suggested in this particular line it's more of a dynamic interaction than one single compound, because when they isolated it, they didn't have any beneficial effect than when it was actually all mixed together or in working in combination. Okay, that is what is suggested, and that is why I've highlighted that part of the paragraph, okay, which will suggest that the correct answer is option B. Okay, and that is what makes it beneficial. Okay, the dynamic interaction or the relationship between all the different ingredients contained in either coffee or tea, not just one single compound. Okay, so I hope that is clear to you. So moving on to the next paragraph and question. I'll give you a minute to read this and come up with your choice of answer. Okay, so let's read this. So, another recent study led by Charles Fuchs, MD, director of the Gastrointestinal Cancer Center at Boston's Dana-Farber Cancer Institute, found regular coffee drinking may help prevent colon cancer from coming back after treatment in a study of nearly 1,000 patients, which says that there was a significant linear association between drinking coffee and lower risk of colon cancer returning in those who drank 4 or more cups a day. The more coffee they drank, the lower risk of recurrence. But researchers aren't clear on which element of the drink contributed to that result, and there didn't seem to be any effect from drinking tea. He says, I think you can have 2 or more cups a day without any concern, and certainly that may benefit you, Fish says. But what about for those who don't drink coffee? If it was somebody who hates the stuff and asks, should I drink it? I did say no. I would counsel them about diet and exercise and avoiding obesity as measures I think would have a smaller benefit. Okay, so that was what the paragraph was about. And moving towards the question, what does linear suggest in seventh paragraph? A, that more coffee people drank, the lower the risk of colon cancer was. B, that coffee intake had no significant impact on colon cancer. Option C, that drinking coffee is proportional to the recurrence of colon cancer. And D, that drinking coffee is proportional to the prevention of recurrence of colon cancer. What do you think is the correct answer? Okay, so let me tell you what the meaning of linear is. The meaning of linear is that it is arranged or extending along a straight line or nearly a straight line. That is what the word linear means. Okay, and looking at the choices, what do you think is the correct answer for this question? Okay, so Liji Raju has responded with D. Sonia Sharan has responded with C. Yes. Lejuke Nair has responded with A. Adria Sandosh has responded with C. Meera Vin has responded with A. Marin Media Kuriakos has responded with D. Okay, so New Thomas has responded with C. Okay, so let's look at the correct answer. The correct answer for this question is D. Okay, that drinking coffee is proportional to the prevention of the recurrence of colon cancer. Okay, so that is what is suggested from the paragraph. Okay, just look at this. Okay, so Fuchs says that there was a significant and linear association between drinking coffee and lower risk of colon cancer returning in those who drank 4 or more cups of coffee a day. So, regular coffee drinking may help prevent colon cancer from coming back after treatments. That means the recurrence of colon cancer will be prevented if you drink a lot of coffee or regular coffee drinking is done. Okay, so that is why they say it's significant and linear. Okay, so and if you look at the other options, A, that more people coffee that the more coffee people drank, the lower the risk of colon cancer was. No, it's not about the risk of colon cancer, but the recurrence of the or the risk for recurrence of colon cancer. That is, colon cancer returning or coming back after treatment. Okay, so it's not just the risk of colon cancer that they're talking about. So option A is eliminated, and B, that coffee intake had no significant impact on colon cancer. No, they are saying that definitely it has an impact. And option C, that drinking coffee is proportional to the recurrence of colon cancer. No, it's not proportional to the recurrence, but it's proportional to the prevention of a recurrence of colon cancer. Okay, so thereby we have eliminated A, B, and C, and we have reached option D, which is the correct answer because that is exactly what is mentioned in the paragraph. Okay, I hope that is clear to you. So now we will move on to the next paragraph and the question. I'll give you a minute to read it by yourself and then we'll discuss it. For your information, they are asking for the point that is not made in the eighth paragraph. Okay. Okay, I'll read this paragraph. Other researchers are asking questions about what role genetics and lifestyle play into the effects of drinking coffee or tea. For instance, coffee and cigarettes once went together like coffee and cigarettes, which cause cancer and heart disease. Okay, some people's bodies process coffee differently than others, says Martha Gulati, MD, head of cardiology at the University of Arizona College of Medicine in Phoenix. Meanwhile, a preference for tea over coffee might reflect other healthier behaviors, she says. As someone who drink tea, do yoga or meditation more, Gulati says, I'm not necessarily saying they are associated. But do they exercise more? Are they drinking things like green tea to maintain their weight better than other types of drinks? Okay, so that is what the paragraph was about. So moving towards the question, they are asking for something that is a point that is not made in the eighth paragraph and moving towards the point, options. A, coffee can affect people differently. B, people's lifestyle may play a part in whether they drink tea or coffee. Option C, there is no connection between genetics and whether people drink coffee or tea. D, research has shown that there is a direct connection between drinking coffee and smoking. Okay, so that is those are the four options. So what do you think is the correct answer? Please respond with your choice of answers in the comment section. Okay, Sonia Sharon Abraham responded with D. Priya Ammu with D. Okay, so let's look at this paragraph. So, and see. Okay, so they are asking for something that is a point that is not made or not mentioned. Okay, so look, let's inspect each of these options. Look at option A, coffee can affect people differently. Is that mentioned? Yes, that is definitely mentioned here. because some people's, okay, they have written that people's bodies process coffee differently than. Okay, so I'll highlight it in green to indicate that is something that is mentioned. Okay, so A is mentioned. Look at B. People's lifestyle may play a part in whether they drink tea or coffee. Yes, a lifestyle may also play a part because they are asking a question that about the role of lifestyle and genetics into the effects of drinking coffee or tea. Okay, so lifestyle may play a part over there. Okay, so that is also mentioned. Okay, so look at option C. Is that mentioned? There is no connection between genetics and whether people drink a tea or coffee. That is something that is not mentioned. They have not given any confirmation that genetics, there is no connection or association between genetics and whether people drink coffee or tea. That association is not mentioned. They have just asked a question whether it's mentioned or not. They cannot say something like that over there because they have not said something like that over there. They have not given any confirmation, because of which you cannot take C as mentioned. Okay, and because of which the answer for this question will be C, because that is a point that is not made in the paragraph. Okay, and moving towards D, but just look at whether it's mentioned or not. Research has shown that there is a direct connection between direct coffee, between drinking coffee and smoking. Okay, so they have mentioned a connection over there, right? That Okay, over here they have mentioned an association. Coffee and cigarettes once went together. Like, okay, it would well, like coffee and cigarettes, right? They have said that which cause cancer and heart disease. Okay, so previously there was a connection like that. Okay, and that is mentioned over there. Okay, but yeah, so all that is mentioned, that is A, B and D is directly mentioned over here, and that is why the correct answer for this question would be option C. Okay, that is, there is no connection with genetics and whether people be, they have not given any confirmation. Okay, they are asking, they are inspecting, they are definitely researching, might be researching on the topic. They are just asking questions whether these are associated or not associated, but there is no direct uh, confirmation about that fact. Okay, about the role of genetics and drinking coffee and tea, and because of which that is the correct answer. So now we have um, reached the end of the discussion of part C, reading subtest. So now we are winding up for today. So thank you for joining us. So see you next week, and take care.